it's been a wild ride these last couple ones.
A lot has happened since we last spoke.
Go Eagles. I was rooting for the Eagles for you. So there we go.
My God, what a season.
Amazing. Amazing. I was wearing my green.
It's been fun because I also feel like I became friends with one of the moms, and so I
I
got to like hang with
know.
them a little bit.
That's so awesome.
And
Doing
what
so many great things. I love it. I'm so proud of
Thank you.
you.
What did you think? Thank you. I appreciate that. What did you think of the Super Bowl, breast health Super Bowl ad?
So, I just feel like, there's always going to be uproar, right? Like, there's always going to be this, I
Right.
think it was really powerful. Like, listen, I see both sides, right? Like, how are you spending that much money? Blah, blah, blah. But you know what? I feel all awareness is good awareness, right?
I
And I
agree.
think sometimes we need to like put those things aside and, I understand everyone's point of view, but there is no such thing as bad awareness, right?
Yeah.
That's what we do. It's all about awareness. And if it saves a life or, I think to captivate that large of an audience, I think was the right thing to do. And I really feel a lot of the ads too were that way
Yeah.
in creating like, I don't know, I just felt everything was very intentional this year of how the ads were done. So I liked it. I loved it. I thought it was a great way to captivate an audience watching. And I also think too, it's a different audience, right? Because you think too, like there's a lot of men watching football too, and men can get
Of
breast
course.
cancer, right? So I think that, that might have been a different take too. I would have done is, focus on all people, right? Getting
Yeah.
breast cancer, not just women. But I thought it was
Yeah.
great.
I agree. I think that they got your attention, which is what they
Correct.
set out to do. And if you go to the website, actually, you can learn your breast cancer risk. You can schedule a mammogram. There's also lots of great resources on there for people who actually have cancer. I don't think that
Exactly.
was advertised, but like I went there and there's like a guide for understanding your pathology report. I actually learned some stuff.
Wow.
Yeah. So there's
That's
lots of,
awesome.
yeah, I think they did a good job. And, and I think that we got the conversation, like we're still talking about it. So it was successful.
Correct. And exactly, like people are talking about it, right? So like that they did their job. But the other thing too is like, I really feel also like the other thing is, having multiple cancers, right? Which I know we're going to talk about. Like that's another thing for me. Obviously, I'm a rarity, right? But I think that that's also an attention, we need to bring more attention to is different kinds of cancers as well, right? Like I think that is
Exactly.
somewhere too where maybe they can shift as well. So really
Mhm.
just share the importance of, knowing your risk too.
Yeah, and cancer screening in general, right? Like
Exactly.
I think there's lots of confusion about that. Yeah, I mean, and again, like, a lot of people were commenting that breasts were sexualized. And breasts are sexualized everywhere. Like if you look at
Everywhere.
other Super Bowl ads, like so they're literally just leaning into like what is being done elsewhere. But like there's so much more
Exactly.
uproar when it's about this, which is interesting.
Exactly. I agree. And you know what?
Yeah.
There's always going to be something, right? Somebody
Yeah.
that likes to create noise. But you know what? It's about creating noise, right? That's
Right.
what awareness is.
Yeah, I would have liked to have seen them include some of breast cancer patients with scars in their ad, as well as men, like we talked
I
about.
agree. I was like, oh, you know what? Maybe I should be in that commercial because I want to just be topless in that commercial because you know what? There you go. So I definitely
Dude,
DM them.
we are manifesting to be in next year's commercial. I honestly think the breast cancer community was right there in front of them for the
Yep,
taking. And I think that,
exactly.
LGBTQ, we need to all be
1000.
represented.
Yes, I 1000%
Yeah.
agree.
But it's funny because I'm like, I do this all year, guys, like
I
follow me,
know, right?
follow the
Exactly,
baby dots.
exactly.
But all right. So we think it.
Yes, I definitely think it was a win. And listen, everybody's opinions matter, but yes, I
Yeah.
think as a breast cancer survivor, I think it.
Yes, absolutely. So I have to say that you are my first repeat guest on the podcast. So
Woo!
congratulations.
I feel so honored, but
You
listen.
should. It is the biggest honor I've given, actually.
Thank you. I thought, what when was our first podcast?
It was a long time ago. I think you only had 5 cancers at that time.
Well, maybe 5, maybe 4, who
Who
knows?
knows? I lost track. So what's happened over the last few years? Like tell us for the listeners who aren't familiar with your story, your amazing
Hmm.
story. Give us like the 1 to 2 minute version of like your cancer journey.
Yeah, 1 to 2 minutes, right? There we
Yeah.
go. But I'll give a little synopsis, right?
Yeah.
So, basically, my cancer journey actually started when I was 18 months old, as a baby. Obviously, I don't remember that time, but I had adrenal cortical carcinoma as an infant, and growing up, obviously, I always knew I was a cancer survivor. It was always in the back of my mind, but never thought I could get cancer again. And I feel like in 1985 when I had cancer, genetics kind of weren't a thing, right?
Hmm.
And then fast forward to 2008, I was diagnosed with breast cancer at the age of 24. And through a self breast exam, I felt a lump. And, I also thought I was too young to get breast cancer. And I always thought I could never get cancer again because who gets cancer twice, let alone a
Hmm.
different cancer? So I had felt a lump. And I think this is a very important part to my story because I neglected to get the ultrasound.
Yeah.
Like I said, I thought I was too young. I'm 24. I was in nursing school. I was like, I can't get breast cancer. I did have an extensive family history of it. At the time, actually, they were testing for the BRCA gene, and I was negative. My mom was negative. So, just never thought about it. Fast forward to December of that year, I went back to my OBGYN, and, I felt like the lump got bigger. And he said, I want you to get a mammogram. He's like, did you ever do the ultrasound? No, I didn't. And at that moment in December of 2008, at the age of 24, I was diagnosed with stage 2 breast cancer. And, at that moment, I was, obviously, I always tell people, and it's so true. I cried for one day because, you hear breast cancer, you're like, oh my God, I'm going to die. And I'll never forget asking my surgeon, okay, what do I need to do? I need to plan my funeral. Like, he's like, no, you plan your trip to Bloomingdale's. That's what we're going to do. We got this. And at the time, I opted to do a double mastectomy with reconstruction just because I'm like, get these boobs off of me. I don't want to deal with this ever again. So went through chemo, everything, did the whole 9 yards. And again, this was in 2008. And, at that time, there really was not a young community of breast cancer survivors. And there might have been, right? But
Yeah.
nobody really talked about it and, so on and so forth. So after I was done with my breast cancer treatment, my mom's friend noticed a mole on my back. And she's like, I think, we need to take this mole off her back, nosy Jewish mothers, which I love.
Hmm.
So
Love.
they took it off and it ended up being a melanoma. And, sometimes, that could happen, right? When your immune system's, weakened, whatever, a melanoma can come about or, whatever. So basically what happened is, okay, here I am, I'm 25. I have adrenal cancer, breast cancer, melanoma. And I'm like, what the hell is going on? So I asked I know this is your favorite part.
This is my favorite part. I'm like
I
holding.
asked my doctor at the time, I said, should I be regenetically tested? My mom and I were listening to a story and they started talking about this syndrome called Li-Fraumeni Syndrome, which is a rare genetic disorder, which now I feel like it's rare, but more and more people have it. And basically he says, okay, I'll test you, but that's in a textbook. Like, I'm like, okay. He's like, but it's very rare. You're probably not going to have it. So sure enough, he told me I was negative. And this is a very key, message that I always like to say is that number one, get the piece of paper, right? Number two, know what you're testing for. And number three, sometimes, if you don't feel something's right, advocate for yourself, right? And at
Yeah.
the time, listen, I was a new cancer patient, right? So I didn't know. So he told me I was negative. And then, a year later, I was getting my PET scan for breast cancer, and they ended up finding thyroid cancer in my neck, and it spread throughout my chest. And at that point, I went to MD Anderson. Shout out to MD Anderson because they're keeping me alive today.
Yes.
And that was my fourth cancer. Um, at the time I went there, they asked me if I was genetically tested for Li-Fraumeni syndrome. And I said, yeah, I don't have it. They looked at me like I had like 75 heads. And sure enough, I tested positive. So by the age of 26, I had breast cancer, thyroid cancer, melanoma, and then my adrenal cancer as a baby.
And
And,
thyroid. And
and
thyroid.
thyroid, sorry.
Yeah.
There you go. Forgetting my cancers,
So there's
whatever.
our five. Yeah.
And so by the age of 26, I had five cancers. And, it was kind of crazy. But a lot of people, ask me, how does it feel to, know that you have this syndrome, right? Because Li-Fraumeni syndrome basically, and I'm not going to give the whole background of it, but basically I'm lacking the P53 tumor suppressor gene, and my body is more susceptible to developing cancers. So I have a long, long laundry list of cancers that I can get. For me, obviously, knowing that I have this has truly saved my life because it has altered my care. Where fast forward to thyroid cancer, I was getting PET scans, CAT scans, all the whole 9 yards because radiation and you can go into this, but radiation is not good for someone with my syndrome. So basically, I have had my treatment tailored now, my scans and everything to align with my genetic susceptibility, which has been a game changer. And I am the early detective on Instagram because I have caught everything early,
Yeah.
right? And I think that is my key message is that early detection saves lives. And that's
Yeah.
why I am 41 now and thriving. Yes, I have a few cancers I've added to my list, but fortunately, everything has been caught early. And I feel very, very, very fortunate. And
Yeah.
that's how I stay positive and keep going.
That's incredible outlook and the best message ever. Like you mentioned, CAT scans for the general public, it's not a big deal to get CAT scans. I mean, when you are getting multiple CAT scans over your life, it is something to think about. It does add up. But in your case, you're very sensitive to radiation. So in your case, you actually do get whole body MRIs. Is it every 3 months still?
Every 3 months. I mean,
Yeah.
we've had it every 3 months still. I've been getting the whole body MRIs every 3 months, probably since about 2011.
Yeah. And this is actually the indication for a whole body MRI. Someone with a genetic syndrome like yours, not Kim Kardashian.
Exactly. And
Right.
that and that's it's so important because I think it's just so important to message too because and I'm so happy you brought that up because yes, I do get whole body MRIs and everybody's always like, "Okay, well you just had a whole body MRI. How did they find that cancer then if they didn't see it on that scan?" And listen, that is not a baseline screening. Like that's like it's just, for me like yes, it's a baseline for me to catch anything, but yes, this is not like a glamorous thing to do.
No, and you're going every 3 months, and this is how they're able to detect the tiny, tiny cancers. You had another one, right?
Exactly. Exactly. Like well, so yeah, so I mean, I get them every 3 months, and then, sometimes if they see something right, they'll do a more hyper focused,
Yeah.
right? And yes, it is a few more tests, but you know what? Listen, like it's saving my life, right? Like
Yeah.
they've caught things so early, like
Yeah.
everything. I've really caught everything so early. And yes, they're in between. Sometimes I do get CAT scans or I do get x-rays, if needed, right? And, of course it stresses me out, but the dose of radiation outweighs obviously the benefit of catching it early.
Absolutely. And
Yeah.
also one thing that when you were treated for your breast cancer, they gave you radiation, which I don't know that they will do that if you have Li-Fraumeni now, but right?
Right. So actually, because my breast cancer kept coming back in my clavicle area,
Mm.
and I'm on Herceptin for the rest of my life. And when they gave me the radiation in 2012, they felt that the benefit of the radiation outweighed the negative of the breast cancer coming get back, and it has. And they surveillance me every
Right.
couple months for it, and I did develop a sarcoma, but
Right.
they surveillance me through ultrasound.
Yeah.
Yes, so like that's where the tailored treatment comes in.
Right. Yeah. So, you're a high risk for developing sarcoma with all that radiation to that focal field. And they were monitoring you with ultrasound where you could see the
A
very
breast radiologist
superficial.
found it.
Good for her. I
Yep,
knew it's a
she's
her.
amazing. Love her.
We love a her breast radiologist.
Shout out to
Yeah.
Dr.
But
Scoggin.
yeah, so you are the testament of early detection. That's so you told me all this your last time, but since our last conversation, which I highly recommend you go back and listen to your earlier episode,
I want to.
Lee Fermini, because I
I
love
think we
that.
should have this podcast called My Body's So Creative because my
Yeah,
doctor has tagged that line and I'm just obsessed with it.
that's really funny. The inner body's so creative,
I know,
right?
right?
So what has happened since over the last year or so?
Yeah, so this year is definitely actually 2 years, and I feel like listen, there's no good time for cancer ever, and I just always feel like things come around my birthday, but that's okay because you know what?
Hmm.
For me, every single minute of my day is a gift. I honestly, and like I know it sounds so cliche and so cheesy, but you know what? If I wake up, that is a gift, and I think obviously anybody who has a cancer diagnosis, anybody who has anything, right? Life is precious. And everybody's always like, do you live in fear? Do you live in No. You can't live in fear, right? If you live in fear, you are not living, right? And listen, I always say my story comes with a disclaimer, right? Never compare your story to someone. I am me and I am me, and my diagnosis and everything I've been through has given me so much purpose in life,
Yeah.
and I just want people who hear my story to not only share my story but to find hope, right? Just find hope and really just be at peace with everything. And for me, as I was saying earlier, everything kind of comes at a weird time, right?
Yeah.
So I turned 40 in 2023, and we had this amazing trip planned for Japan. My husband and I had never been out of the country. We never went on a honeymoon. We're like, this is awesome. And I back to MRIs. I get because of my syndrome, I get brain MRIs every year. So I would get them every March, and I had my brain MRI in March of 2023. It was perfectly normal,
Hmm.
and basically what happened was I work from home, and I was just like, started to feel weird. And I messaged my team and I was home by myself. And this was in 2023 of November. I'm sorry, October 1st. I say November, October. It was, I call it the Halloween seizure. So basically what happened was I was home and I was home by myself and I was getting ready to go trick or treating with my nieces and nephews. I somehow woke up in my bed and I was like, what the hell is going on? Like, how did I get here? My father calls me and I was so out of it. Long story short, takes me to the emergency room. Never told them I bit my tongue. Here we go. Like me, I'm like, be an advocate, tell them what you did, didn't tell them.
Mm-hmm.
And we go to the ER, everything was normal. I went for side pain and they sent me home. And then I came home and I was like, I don't know, just something is not right. Like something
Yeah.
wasn't settling. Intuition, right? Always. I always say, like, if you have an intuition about something, speak up. And the next day I call my doctor and I was just like, I don't know, just something is not settling with me that like I bit my tongue, I don't feel right. So long story short, she's like, let me order a brain MRI. Just something doesn't sound right either. So she actually ordered a brain MRI and I'm driving. She's like, you need to go home right now. You had a seizure and there's some spots on your brain. So I was like, oh my God, in my temporal lobe. I was like, what do you like? This is just blown. And they were tiny, right? Like, of course, they say it's metastatic disease. They don't know. Fast forward, went to MD Anderson, ended up having a craniotomy, which honestly never thought I'd add that to my repertoire. I was like, oh, never thought. Did you know that the brain has no pain? Which I still just can't I just can't wrap my head around that. No
Wow.
pun intended.
That's
So,
very fascinating.
had a craniotomy November 21st of 2023. And I will say that was probably brain cancer has probably been the scariest thing I've ever been through.
Yeah.
And it's really, it's just because, it's your brain, number one,
Mm-hmm.
but number two, it's just, there's not a lot out there right now, right? Like
Yeah.
there is, but it's more common, which is kind of crazy. Like I'm meeting so many people who have been, on these journeys too. And they did the craniotomy and I was diagnosed with glioblastoma. Again, fortunately caught super early.
Yeah.
It's in my right temporal lobe, which they even said too, it is a literal miracle that I had a seizure. So
Yeah.
like it was small and like my surgeon did 100% resection, which is
Mm-hmm.
another thing. Like, a lot of times glioblastoma is not caught early.
Yeah.
And this was caught early. And I mean, I just feel so grateful. I did 30 rounds of brain radiation
Wow.
for my 40th birthday. It was fabulous.
Wow.
Flew through it with flying colors. I did oral chemotherapy. We ended up going to Japan, which was absolutely amazing because my doctors were like, it's been like it's been over a year and a half now, and I just had my second craniotomy 3 weeks ago, maybe even a month ago, whatever, because of the necrosis from the radiation. Again, back to the radiation
Yeah.
grew and there's small little glioma cells. So I'm starting a new treatment right now. But,
Mm-hmm.
it really is, it has also given me like a whole new look because, on life, because, it's really my mind and it's really kind of shifted me a little bit because
Yeah.
I'm not, I always tell people I used to be 120%. Now I'm 110, right?
Right.
But, it's really, glioblastoma has definitely been one of the hardest cancers.
Yeah.
But at the same time, too, it's really fascinating that, like, just how far we've also come in that space and that I can take a pill right at home. And, it's just crazy. So I'm on a new chemo regimen now, but like, there's so many things out there. There's still not a lot, but there's so many things out there right now. And, again, caught it early. Like, that's the thing. It's, I really just feel that, it's all about early detection because we won't see those big stages and we won't be seeing all if people just act and if something's not right you
Yeah.
need to act and like I can't say it enough because it's crazy. And then I had another cancer in between that which we can talk about in a minute too but because my body is just so creative and it's really just because I'm the only one that gets cancer in the awareness month that it happens in, so it's just that's how I roll.
That's right. You're like, oh, it's Lung Cancer Awareness Month. It's been a
Just give me lung cancer, and
yeah.
that's another fluke that I had, so like I was getting a nerve sheath tumor removed and that they caught on an MRI and it was benign, thank God. The doctor was like, I might be able to do it laparoscopically, but let me just get a chest CT and see if I can actually do it. And the chest CT caught lung cancer at stage 1. And like I had radiation for like 4 rounds, tiny dose. I'll follow up in March to see if everything was great. But like I feel great. And again, like another cancer, like young, caught early. And like for me, that's why I'm here, right? And that's
Yeah.
why it's all about early detection. And I
Yeah, I was gonna
can't
say,
message that more.
yeah. Your purpose in life is to spread the awareness of early detection for all cancers, not just breast.
Exactly. Exactly. I'm all colors of the rainbow.
Right. I mean, seriously, like, when, especially with, I know there's statistics on breast cancer, but I'm sure it's the same for all. But, when you catch, breast cancer early, it's like got a 99% survival rate. And that's the whole point. Like, that's why
Exactly,
you,
exactly. And it kills me like when people are diagnosed like so late and then stage four and it's you just can't be scared, right? You can't ignore that. It's like don't ignore your bills and don't ignore your
yeah,
health, right? Like it's just it's not worth it. It's just not
yeah,
worth it. There's so much out there, there's so much out there and so much awareness and just you can't be scared because the
yeah.
scary alternative is the other alternative.
Yeah, denial is the river in Africa. Actually,
Exactly.
I was going to go to Dochi. I was like, I ain't a killer, but don't push me. Oh my God. No, but I'm really just taken back, and I'm sure my listeners are, about how positive you've been able to stay throughout this like cancer journey. It's really remarkable.
Yeah, I mean, listen, and it's my only other option is to sit in the corner and cry,
Yeah,
right? And you can't do that. And I think that, obviously we've known each other for a while, but at the same time too, the community that surrounds us is just so incredible and so many
yeah,
stories. And I always say life could be so much worse. And people are like, "What do you mean?" It really could, right?
yeah,
Like I'm
yeah,
very fortunate and I do feel that life could be worse, right?
yeah,
And I listen, nobody knows what tomorrow brings. Nobody does. And,
absolutely.
I honestly just feel that I have been given this gift and, a gift of cancer, I guess we could say. So I always tell people the only thing I'm missing is my sign isn't cancer, which I guess that's a good thing. But, I just feel that I'm so lucky that I have the entire world cheering me on and an incredible team of doctors. And
Yeah,
I just think the most important message too is to be your own advocate.
yeah,
You have to speak up. I mean, I had 3 weeks ago, I had a seizure for the second time and from my diagnosis I'd never had a seizure and it was because my meds were messed up and I wasn't on enough steroids and they had discharged me on the wrong dose of steroids and my husband had said something but we try we of course people make mistakes right
yeah,
everybody's human but we had questioned it but we didn't question it further right and I again back to where when I was diagnosed early on it's okay to question a doctor, right?
yeah,
It is okay. Everybody's human. Everybody makes mistakes. I questioned a doctor once because he asked me what's on my bucket list. I go, you should know your audience. Okay. We're in
yeah,
a brain center. Know your audience. Okay. I
right.
have a bucket list. I don't have a bucket list, but it's very important. Everyone's human. And
Yeah,
I think it's important to teach people a lesson in a very kind way, right?
yeah,
And it's okay to speak up.
yeah.
Everybody needs to speak up. It's going to make the world a better place.
Absolutely. Your cancer team has to be, it's a marriage, really. It's
One,
a long-term commit. So you really need to find the right team. And if you don't feel like they're the right fit, or you feel like you might be being gaslit a little bit
yep,
or dismissed, then, it might be time to get another team. And doctors,
exactly.
we can handle it. Like we can, I,
Right.
I, I always tell people to get a second opinion, and you may find that the first opinion was right, but like at least you feel like you've asked the questions.
Exactly. And also just like opinions from your peers too, because of course a lot of people call me all the time for things. And,
Yeah.
I just think it's really important to remember too is it's okay to ask for advice from your friends, right? And the friend giving the advice, never take offense if they don't take that advice, right? I
Yeah.
think it's just really important. Like I always give people advice, I always share. And I always say, you do what's best for you, right?
Yeah.
This is the way I did it. And
Yeah.
you have to do what's best for you. So just always remember too, it's everybody has their opinions and things, but never take it to heart, right? I think that
Yeah.
that's also something I've learned too, because everybody's like, "Oh, where'd you go? Where'd you go? Where'd you do? This is what I did, but you do it how you want to do it." Because
Right.
I never want to have that guilt, right? I never want to have guilt or something. So I think that that's also just something to,
Yeah.
just give suggestions. That's okay, and don't be
Yeah.
offended if somebody doesn't take your suggestion.
Yeah. What is a good friend or supportive partner? I mean, your husband's like literally deserves a
Oh
award
my
for,
God, a Pulitzer Prize, anything he
yeah.
deserves. I don't even know. I mean, he's incredible.
Yeah. But what does like a good partner or friend look like when you're going through cancer treatment?
I honestly, oh my God, I have just so many incredible people. I think, just someone who just says, "Hey, how are you doing?" Just
Hmm.
checking on you, like,
Yeah.
or just picks up the phone to like say, What's going on today? And, honestly, like I have been so lucky to have just such an incredible support system from all over the world.
Yeah.
And, even if somebody just sends you like an inspirational quote, right?
Yeah.
But not ghosting someone, right?
Yeah.
Because you don't know how to react. And that's okay. I think for myself, I don't want to say I've lost friends because every friend I have is still my friend, even if I haven't talked to them in 1,000
Yeah.
years, right? I have no enemies in my life. I think what people need to remember is people don't know how to deal with a cancer diagnosis, right? Some people have no idea, and that's okay. But I think what a friend can say if you don't know how to deal with a cancer diagnosis is, I don't know what to ask. How can I help? Not even how can I help? What
Yeah.
what what do I ask you? Not what do you need? Because honestly, I'm not going to say I need anything, right?
Right.
But just saying, I don't know. I have a friend who's very just wasn't sure, right, what to do. And I explained everything to her. And listen, not everyone's an open book. I'm a
Yeah.
fishbowl, right?
Yeah. Right.
And I think sometimes you can read that friend who's just scared to ask questions. And if you're okay with it, share what's going on. Maybe be a little more open. And
Yeah.
ever since I did that with my friend, it has been a game changer.
Uh-huh.
She asked more questions and everything because I would say a majority of people have no idea
Yeah.
what to do. And
Yeah.
I think just being that for the friend on the side who doesn't know what to do,
Yeah.
just ask the question of what's scaring you, right? Like what, and that's okay. That's
That's a good
okay.
question.
I think that just say what is scare what like say this scares me, right? I'm scared that your cancer is going to come back, right? Or I'm
Mm.
scared that you're not going to be here in a year, right? That
Yeah.
that friend can say that, right? And depending on who the person is, right? I'm sure they're going to say it's okay. This is what's going on, right?
Yeah.
Because it's really, it's hard for people on the other side, right? Like I've been a caregiver. My parents are both survivors, and it's hard. Being a
Yeah.
caregiver is freaking hard, right? Like I would much rather be the patient. I have to be honest.
Mm.
But, there's people who don't want to talk about it, and they'll tell you right there, I don't want to talk about it. And then there's people who are be like, I mean, me, call me, I'll tell you everything.
Right.
So I think you just know your audience, but being a friend is just picking up the phone and saying, "How's your day going?"
I
Right?
love that.
And that's really it.
What scares you?
What scares me? Oh my God, it's funny. I think for me right now, I don't have a lot of fear, right? Like I don't. I think the hardest thing right now is, just the scariest part, obviously, of brain cancer, right? Is like the treatments, right? I've never been in a situation where, okay, that treatment wasn't strong enough. We got to go to the next treatment. But,
Mhm.
fortunately, everything's good. So I think just the fear is like sometimes is just like, hmm, like, where am I going to be in 25 years?
Yeah.
I really don't have fear though, because
That's
it's
good.
I really just feel that, every if I can't live in fear. Like I
Yeah.
literally I truly do not live in fear. And like I just feel that, silly as it sounds, it's a good day and age to have cancer. There's so much out there. There really is so much out there. Honestly, the biggest fear right now for me is research, right? But I really like, I just think, we need to keep research going. Research
Yeah.
is so critical. So I
Absolutely.
just think that, for me is I don't have fear. I really do not have
I love
fear
that.
because I really just love I love life. I really do. I want to travel more. That's really like I might be able to go. Like my fear is like, okay, I want to go to Japan again, okay?
Yeah.
But I think for me is just I want to like I really don't have fears. I really don't have fears, which sounds crazy, but I don't.
Cancer is your superpower.
Actually, my fear is a roller coaster.
Oh, really? Oh my God. We got to get you on a roller coaster.
I hate roller coasters. I literally hate them.
Are you even allowed to go on them now because of your history of seizures?
Kind of hope I don't. I hope I can't. But listen, I
That's
went on
so
Guardians of the
interesting.
Galaxy and I whited out because of I have no adrenals. So
Oh my God.
listen. But that was great, and I think that's the last roller coaster I'll ever be able to go on.
That's so funny. Of all the things, out of all
Yeah,
the
of all the
things.
things that my fear is roller coasters. There you go.
So you're done with your treatment for your brain cancer now?
No, so I actually just started a new brain cancer treatment last week.
Okay.
It's called lumestine or CCNU. It's
Mhm.
another form of pill, stronger, to kill any little things that have little legs that they just
Okay.
removed. I have little glioma cells in my necrosis. So they're gonna zap those babies out. I'm on it for I'm doing 6 rounds once every 6 weeks, and it's a pill. I take it from home. I say like I just don't even have to wear pants. It's a great thing, right? And it's, so far I've had no side effects from it. Something about me too is like, fortunately, I've really flown through chemos. I've done a lot of chemo. I think I've done 4 different types of chemos, lost my
Yeah,
hair twice. Fortunately, I am health. I'm a very healthy person. So I always tell people I'm very healthy. I just have cancer.
I
So
like that.
I have really, just flown through treatments really great. So they felt, I did excellent on this last treatment. So they feel I'm an excellent candidate for this. So, listen, brain cancer is, I mean, every day is one day at a time, but brain cancer is literally one day at a time. I get brain MRIs every 6 weeks. And, it's just, yeah, every 6 weeks. So me
Yeah.
and that MRI machine are best friends. I go back and forth to
Wow.
Houston every 6 weeks. So, that's the other thing too is, my body is like a chessboard, right?
Huh.
I think that that's probably one of the hardest things too is, right now we've got to focus on the brain. There's always in the back of mind, can breast cancer come back? Can adrenal cancer come
Yeah.
back? Lung cancer come back? So, really that's the other thing too is, we really got to like, it's literally a chessboard, but, I just have an incredible team of doctors that drive the ship. And, in March, I'll follow up for the lung to make sure that the radiation works. Really, those things are always in the back of my mind, right? Like, what if this happens? If this happens,
Yeah.
but you know what? I just trust the process. That's it. I trust the process. I know I'm in the best of hands and ask questions if there's questions.
Do you have scanxiety?
Oh my God. I mean, who doesn't have skin anxiety? Actually, it's
Yeah.
funny. I just started Lexapro. I'm very, very a big advocate of Lexapro for anxiety because I never knew I had anxiety, but I just slept through the whole night since I was 24, which I think is the greatest thing that helps me sleep for anxiety. So yes, I do have skin anxiety. And I think for me this last month, because I had the seizure, I was not able to get my whole body MRI at the end of January. So of course that's, giving me a little bit of anxiety, but for my skin anxiety, I think for me, and I think I shared this once before, but I live my life in 3 month increments, now 6 week increments, because I tell myself if there's something there, it's only 3 months old.
Yeah.
Or if there's something there, it's only 6 weeks old. And
Yeah.
I think that that really helps me get through it. So I think, just whoever has skin anxiety, right? I'm sure anybody getting scans does, kind of tell yourself that going into a scan, right? If you get a scan every year or if you get it every 6 months, just say it's only a year old. And more importantly, stay on top of your scans, right?
Yeah.
So I think that that's really helps me get through my skin
Yeah.
anxiety. I'm human, right? Of course, I get anxious. But for me, I think the brain though too has definitely been harder, right? I have more anxiety over the brain than I
Yeah.
do with whole body MRIs. But for me, that's kind of how I deal with my skin anxiety is, I give myself kind of increments, right? So, I mean, listen, I have to have the scans and I feel really good after I have the scans. But
Yeah.
yes, skin anxiety does suck.
For real. I can't even
It's the
imagine. I
worst.
mean, yeah. Have you had long-term side effects from your treatments? Like, well, specifically the brain, but all of them, honestly.
Yeah, so I've been pretty fortunate. From the breast cancer, I have lymphedema, which, people, if you have lymph nodes removed, stay on top of it. I did not. I was in the hospital with cellulitis infections, but I wear my sleeve 24/7, 365, stay on top of it all the time. Other side effects, really no. I mean, I really have not had anything crazy. Obviously, I don't have adrenals as I shared. Just obviously a little like issues there, but nothing
But you're
crazy.
like
Yeah.
super chill.
Actually, I'm probably the opposite. I don't even know. I mean, I have a little piece of adrenal tissue that works, which is
Yeah.
another like crazy. That's another podcast episode of me
Uh,
being a mutant. But I really don't have any side effects. Which listen, I feel really fortunate. But lymphedema, I would say, is the only side effect that I've actually had from breast cancer, and obviously, like the arm, crap from radiation, but no. And, I did do a double mastectomy with reconstruction. And then I did take my reconstruction out because I had, infections and so on and so forth. So I'm flat and fabulous, but really, no side effects. The brain, the only, really is just short-term memory a little bit, but I've really gotten under control. And, just, if I'm not feeling good, all those things, I need to listen to my body, of course. But no, I mean, I work full time, I live a normal life. Like, really, I've been very fortunate that like I don't have a lot of side effects.
oh, we got a visitor.
Is that Leah?
That's
Leah?
Jordan. Good info.
Jordan. Good memory. Look at me.
Sorry for the interruption. Snow day, snow delay. You don't have to deal with that. I know. What is your best advice for someone who's been newly diagnosed with cancer or going through cancer treatment?
My best advice for someone who's newly diagnosed, I truly just feel, listen, it's okay to cry, right? Everybody, you can have your moments, but don't dwell on it, right? I think that it's so important not to dwell on your diagnosis because, and listen, people will, right? Everybody will.
Yeah.
You're allowed to have your moments, but you need to really just focus on how you're going to get over that, right? Not get over it. I think that that's not a nice thing. Just
Cool.
climb and go higher and
Yeah.
cope with it, right? Find yourself, your inner self, and just say, I can do this, right? I got
Yeah.
this, right? And really, I think the most important thing is be proud of yourself, right? That you caught it, right?
Yeah.
And you're gonna beat it, right? You're gonna get through
Absolutely.
it. And I think to make sure something for me, early on in 2008, right, was being open about it, right?
Mhm.
Not hiding from it because number one, right, it will help you cope, right? It will
Yeah.
help people around you cope and you'll save a life too, right? So
Yeah.
I think not hiding behind it, being open, like I would turn to Facebook and just write things, right?
Right.
And not like, and listen, everybody can journal, you can do your thing, but be vocal. I
Yeah.
think that that is probably one of the best things I ever did early on when I was diagnosed is speak about what I was going through because not
Yeah.
only did it probably help save another life, but it helped me, right? It helped me like, and it also made that friend, like I was talking about earlier, who didn't know what to say, know what to say, right?
Yeah.
And I think that that's something I would say probably the best advice would be is don't hide behind your diagnosis.
I love that.
Be you, be the person you were before your diagnosis. And if you weren't that open person, be the person that people want to come and it's going to be helpful for them too. So don't hide behind
Absolutely.
your diagnosis. Embrace it. As weird as that sounds, embrace it.
Yeah, lean in. I mean, especially in the age of social media, like telling your story, everyone has a story and it's so powerful. And you are helping so many people that you may not even, you may not ever come in contact with them in person.
Exactly. And laugh. Laugh. Honestly, like humor has been the best thing for me
Yeah.
because it is, listen, when I told my doctor called me to tell me I had lung cancer, just was laughing so
Right.
hard because I'm just like, is this like real life? And listen, of course, everybody has, you can find humor in whatever you want, but
Yeah.
that's me. But it's okay to laugh. It's okay to
Yeah.
laugh and it's okay to cry.
Absolutely. And I think that, speaking to many people who've been affected by cancer, I think it makes you stronger and like a better version of yourself.
1,000%. Like I look back at myself at like 24 years old when I was like
Yeah.
partying, wearing very low cut jeans. I'm with my
Yeah.
husband who I met at Abercrombie and Fitch, and like I look at that and I'm like,
Yeah.
wow, I'm effing proud of who that person is today, and I wouldn't change any second of my life in this moment. I literally wouldn't.
Love
Like
it.
I'm so proud of myself. I'm so proud of my husband and my family. Like I just like
Yeah.
listen, it's harder for everybody around you, but like I would not change 1 second of my life. Honestly,
Right.
like I really
I love that for you.
I love that for me.
What
Stop.
I could talk to you forever.
I know, right?
What do you want to do this year? Like what's on your bucket list for this year?
That's another thing too. I would say too. I know you love pink. I love pink too. But when someone is diagnosed with breast cancer,
Yeah.
make sure they like pink
Yeah.
because when
Before
I was
you.
diagnosed, yeah, when I was diagnosed, I got a lot of pink, and now pink, as I have pink nails because it's always Valentine's Day, but pink is not my favorite color. So just ask that question if they like pink, because sometimes people, it's a trigger thing for people. Oh, they're not your favorite.
That's a
Yeah,
good
yeah.
point. Yeah.
Just ask if they like pink. Maybe like I love rainbows, so like anything rainbow is my thing. Pink, not so much. But that's I like pink accessories.
I like that. Rainbow's your favorite color.
Rainbow is my favorite color. Like literally, if anybody asks me, I'm a real life unicorn.
I like that.
Okay, so what's on my
What's on
list
your
for this
year?
year? On my year. So we definitely want to travel more.
Yeah.
And it's funny because we fortunately I have a new role and I can travel eventually. Like and it's a little bit more flexible, which is great. But
Yeah.
we want to go to we have London on our list, so we're trying.
Okay.
We don't really. It's funny. Japan was like the one trip we actually planned for, and then here we go. So we're just kind of spur of the moment people, right?
Go with the
So
wind.
right. So we're going to Disney this weekend because
Oh,
we love Disney. And then we want to go somewhere in Europe. We would like to go to Seoul, South Korea. Can you tell we have a big obsession with East Asia?
yeah.
And then I don't like, we're just kind of looking at places. We have no idea. Like, we're looking at Anguilla. Yeah, so listen, we just kind of go by the seat of our pants. If we see
I
something
love
that we
that.
want to do, we go. Maybe go to Disneyland in California. We've never been. We
Oh,
did go
that's a
to
good
Japan
one.
Disney, which was incredible.
Yeah,
So yeah, we just, listen, we go to Houston all the time too. That's usually our vacations, but my husband is he loves the ocean. So we might go somewhere in beachy land, but we live in Florida, so we're always in beachy land. We would love to also go to Australia. That is another top of our list, Australia, New Zealand. We have a lot of friends from sleepaway camp that live there too. So that's kind of another one that's on our list is Australia, New Zealand. So
I like that.
we figured we did a big trip to Japan and we can tackle any flight.
Absolutely. I feel like Lainie Jones, you just beat cancer 7 times. Where do you want to go? Disneyland.
Exactly, Disneyland, right? Australia. We'll
Disneyland,
say
please sponsor
Australia.
this.
Australia. That's a better trip,
That's
right?
good. I feel like Disneyland needs to sponsor you though and bring you out.
Oh my God, I know, right? I just love Disneyland.
I know me too.
Wait,
We
so
are
do
Disney
you.
people too.
Yes. We're cool Disney adults. I always say
Yeah,
that.
we are
We're cool.
definitely Disney adults.
Yes, we are definitely Disney adults, which I have to send you this really cute brand that has cute Disney stuff.
I love it.
Yeah,
Well, always a pleasure talking with you. I love
I
you
love it.
so
Love
much.
you so much. We have to take a photo too.
Yes, absolutely. And I wish
Yes.
you the best of luck in whatever your
Thank you.
cancer journey looks like. And I hope you go to all these amazing places and you keep,
Thank you. And you can follow me at the Early Detective.
there
And
you go.
listen, we listen, thank you for everything. And I always say, I remember our first TikTok that we did together. And we I think we need to post that because, you were
It's
my
been a
first
while.
TikTok I ever did.
I know in the parking lot and that weird guy. That was, what was his name? We'll never remember his
Oh my God.
name. Yeah.
I'll jog my brain today and find it. That'll
Yeah.
be a good exercise.
Hopefully it's in your left temporal lobe.
Exactly. Me and my cognitive abilities, which could be a whole
Yeah,
episode because that is a fascinating world.
I'm sure. All right. I love you. Take
Love you
care. Be
too.
well.